Across Canada, it's well known that we have a healthcare crisis. We certainly need to do a lot to fix the system so that patients get better care. We talk about that a lot on this show, but we also need to talk about the other side of the equation, the demand that patients put on the system in the first place. Specifically, what can we do when it comes to prevention? Today, I'm excited to chat with a guest from Ottawa. He's the department head of critical care at the Ottawa Hospital, and he's written a new book called Prevention Over Prescription. Please join me in welcoming Dr. Kyeremanteng. Doctor, I'm so glad that you could join us today. This is a topic I'm really interested in because I don't think we talk about it enough in this country. And like I say, that demand that we as patients are putting on the system and how some of that could be avoided through lifestyle choices. So I'm wondering maybe if you could just tell us a little bit from the top why you decided to write your book.
Honestly, Colin, it came from my experience during the pandemic, where we saw a lot of patients land in the intensive care units based on metabolic syndrome. So, metabolic syndrome being
Mhm.
prediabetes or diabetes, obesity, high blood pressure. And long story short, I didn't realize that a lot of these conditions were reversible. And this is not something we learned about in medical school traditionally. And so I hosted
Mhm.
a podcast at the time, Prevention Over Prescription, and we would bring on these guests that would teach you about ways about reversing metabolic syndrome and people getting healthy again. And it was a big aha moment for me when I realized that if we do focus on prevention, not only are we going to see people less people suffer, less people dying, less people landing in hospital, but we're going to put less strain on the system. We're going to we're going to have patients going through less PTSD, anxiety, depression, severe disability, like we've seen
Mhm.
over the years when it comes to landing in hospital. And this was specific to the pandemic, but you're also looking at other disease states that got better as well. So heart disease, strokes, general infections,
Mhm.
like being fertility, cancer risk, everything gets better when we focus on preventative health. So to me, it was a big aha moment, and really wanted to dive in and give people the tools to achieve a more healthy life.
I'm curious about your take on this. So my observation as someone working in the public policy world was that I feel like the government maybe missed an opportunity to encourage people to live healthier during the pandemic because you had a lot of people who were concerned about getting COVID and all the consequences that could come from that. Um, but yet we didn't hear this message that you were just talking about from government, and that is that, one thing you could do to improve your health and reduce your risk of serious problems from COVID, go for a walk, exercise, maybe reduce alcohol consumption, change your diet, try and improve things so that you could reduce your probability of getting some of those comorbidities. Do you feel the same? Like, did we miss the boat there as a society to talk more about that during COVID?
Oh man, Colin, I thought there was just this huge opportunity early in the pandemic where
Yeah.
there was that lull after that first wave, and we were going into summer months. And imagine as public figures, imagine as policymakers saying, we see this link of metabolic syndrome, of unhealthy folks.
Mhm, mhm.
And if we now focus on health, getting active. Let's get outside and walk at the time at a distance, or walk together. Let's think about what
Yep.
we're eating. Let's ensure encourage our kids to stay active as they're growing up. Like let's give the people the tools to reduce their stress, or emphasize the importance of reducing stress. And I think we could have created a movement at the time where not only once again,
Yeah.
not only would we improve our COVID risk, but we would are so many other aspects of health, including mental health. That There's more and more evidence supporting
Mhm, mhm.
improving your metabolic health will reduce your psychiatric concerns. So honestly, I still feel strongly about advocating for it, obviously, but holy cow, what I
Yeah.
mean, we were all at home, we were all ready to do something. We were all ready to be part of some form of a movement. This would have been super powerful.
Yeah. Well, especially, I mean, for almost everyone in the country, COVID is still very top of mind. We all remember it vividly. We went through it. Maybe there's still an opportunity for governments to capitalize on this. When we come back, I want to continue to dig into this issue with you, doctor, and talk about prevention. Maybe some things that people at home might want to consider. We'll be back in just a moment.